Health Department in Gauteng announcing that it's put measures in place to fast-track the filling of nursing posts. As part of President Cyril Ramaphosa's economic stimulus plan, 650 new posts will be created. Now, some 240 of those positions will be used to absorb professional nurses. To tell us more, we're joined by the Gauteng Health Department's Head of Hospital Services, Medupi Modisane. Medupi, good morning, and thanks for your time. So just looking at, let's talk about the situation regarding our nurses and the hospitals and the shortages we have at the moment. But we've seen that government has spent quite a bit of money training nurses but can't find places for them. How is that possible?
The challenges, Uveka, are related to budgetary constraints. We do train our nurses through our nursing colleges who have their own budget for training. The challenge is once they've trained, if they get placed in hospitals, there must be a budget to pay them. And given the challenges of financial constraints over the years, it has become more and more difficult to appoint them as the Department of Health in this province, but in all the other provinces, is overspending on staff, including nurses. Even though we all accept that nurses are the cornerstone of the healthcare service, we have to work within a budget.
So how do we solve this? What do we do? Because we need nurses, but we don't have the money to pay them. But we've used money to train them. It boggles the mind.
The only plan forward is to actually find a way to increase budgets to be able to accommodate the nurses and all the healthcare professionals that are in demand. The stimulus packages, as announced by the President, is one of the solutions. It is a short-term solution, but it will actually make a huge difference because we'll be able to absorb those 245 nurses. These are the general nurses that have just qualified, but there are additional nursing posts for more experienced nurses to prop up the service in the province.
So where does this leave hospitals? I mean, what are we seeing happening? 240 is not a hell of a lot.
It is not a lot, but if we look at our needs and we distribute according to the needs, it will go a long way towards alleviating pressures in critical areas that the department has identified, being the mother and child health, mental health, and accident and emergencies, which is where most of our high acuity work happens.
So tell us a little bit about that stimulus package. What in it, just basic so that we can understand. What does it include? How does it make this possible?
It is an ex gratia grant from the department and from National Treasury, and it is made available to all the provinces. For Gauteng, it is funded in tranches based on the annual budgets. For the remaining quarter of this year, we have 65 million rand that we need to use to appoint those staff members that have been identified by the package. The package has actually identified the staff that are critical and have given a list of those that we need to appoint, including the 245 nurses. And then for 2019, meaning the financial year from April, there's 138, and the money increases to the outer years. Basically, it's in addition to whatever budget the department has.
So I'm just looking at an article here, Medupi, and I just want to see, I mean, according to the Star, Gauteng community service nurses were told that they would have to find new jobs, that there won't be any community service nurse contracted after February, after next month. And they were told in December that they'll have until February to find jobs because there are no posts, and nobody told them. And then they said that, telling them that they were in the post of cleaners, doing the jobs of cleaners. Now, just clarify for us what was communicated to these nurses, and what were they told initially and now being told that they are not going to have a job come February?
The community service is a one-year service. After training of healthcare professionals, they give 1 year of community service. And all professions are subject to the same prescripts. What used to happen in the past is post-community service, they then get absorbed into permanent positions. Community service posts are actually temporary posts. It starts in January and it ends in December, and then you need to move into a permanent post. And in the past, it was easy to absorb them because of financial challenges. That problem has actually surfaced. The issue of them being in wrong posts, if you remember, the part of the training cohort comes from the institutions. You find somebody who joined the hospital as a cleaner or as a porter, qualifies to go and study nursing. So they actually get sent by the department, but they remain in that position until they complete. So if when they complete, there is no actual nursing post to absorb them, what should have actually happened was to release them. But what the institutions did was to keep them in those posts, hoping that with financial resources, more posts will be created, then they'll be put into those.
Well, you can understand why they would be so upset about this, because they've spent all these years training for a position, not looking for any other job, only now to find you're unemployed. And then you say that, you know, these posts can't be filled because of financial challenges. What are these financial challenges? Because they're asking, where did the money come from in the past, all of a sudden for you to say that there isn't any money?
The problem is that the demand for health services in Gauteng has increased, and it has outstripped the budget. So as the number of student nurses qualified, the budget hasn't kept up to be able to absorb all of them. And that is the reality of our situation. And we're hoping the stimulus package will absorb the 245, and there'll be about 300 odd outstanding that we still need to make a plan of how to.
So you are looking at making a plan?
Yeah.
Okay. All right. Thanks very much for that. That's Gauteng Health Department's Head of Hospital Services, Medupi Modisane.